A warm welcome. Our conversation today will be a little unusual, but very important. We'll talk about how our face, the mirror to our soul and health, can sometimes give us subtle signals that are worth paying attention to, especially when it comes to the health of our heart. Have you ever noticed that as the years go by, your face changes not just because of wrinkles? Sometimes, barely noticeable signs appear on it that might be more than just cosmetic features, but rather a quiet whisper from our body, warning of potential heart problems. After all, with age, our blood vessels, unfortunately, lose their former elasticity. Cholesterol can silently build up on their walls, creating obstacles to free blood flow, and chronic low-grade inflammation can undermine health from within. All these are risk factors for the heart, but our body is wise, and it often sends us signals in advance. Today, we'll discuss 5 such potential clues that can appear on the face. Remember, this isn't a reason to panic, but a reason to be attentive to yourself and perhaps for a timely conversation with your doctor. I promise, we'll go through these signs calmly, without complex medical terms, and you'll understand what to pay attention to keep your heart healthy and strong for many years to come. Our advice will be simple, and knowledge is your power. Let's watch this video to the end to get the full picture and feel more confident. Let's start with something perhaps unexpected, our ears, more specifically, the earlobe. The first sign we'll pay attention to is a small diagonal crease running from the ear canal to the edge of the earlobe. It's also called Frank's sign, after the doctor who first described its connection to heart disease. Imagine the earlobe, soft, delicate. And there, as if someone carefully drew a line, a diagonal wrinkle appears. Why might this be important? It's believed that such a crease might indicate problems with small blood vessels, their lack of elasticity, or even blockage. And the condition of the small blood vessels in the earlobe can reflect the condition of blood vessels throughout the body, including those that supply our heart. Of course, it's important to understand, not everyone with such a crease will necessarily have heart problems, and vice versa. It's just one possible signal worth noting. Let me tell you the story of Arthur. He's 72. He was always active, loved walks in the park, but for the last couple of years, he started noticing shortness of breath when climbing stairs. He attributed it to age, a few extra pounds. He had seen this crease on his earlobe long ago, maybe 10 years back, but considered it just a feature of his appearance. Well, a wrinkle is a wrinkle. His wife sometimes joked, calling it a mark of wisdom. Arthur brushed it off. Inside, of course, he was a little worried about the shortness of breath, but the thought of going to the doctor seemed excessive, almost a sign of weakness. What am I, some falling apart old man, he thought. But one day, he came across an article mentioning this very Frank's sign. He went to the mirror, carefully examined his earlobe, and something clicked inside him. It wasn't just a coincidence, it was a reason to think. He decided not to wait for a bolt from the blue and made an appointment with a cardiologist. The examination showed that Arthur indeed had initial signs of coronary artery disease and high cholesterol. The doctor praised him for seeking timely help. He was prescribed supportive therapy and his diet was adjusted. Do you know what changed the most? His attitude. He stopped ignoring his body's signals. He didn't feel like a victim of age, but like a person who took control of the situation in time. His shortness of breath decreased, and his confidence in the future grew. That small crease became not a sign of trouble for him, but a reminder of the importance of self-care. Think of it this way. If a crease appears on a smooth piece of fabric, it might indicate tension somewhere nearby. Similarly, this crease on the ear might be just a small external sign of internal tension in your vascular system. Look at yourself with love and attention. But the ears aren't the only place on the face that can tell us something. Let's move our gaze slightly higher to the eyes. Here, the next sign might await us. Xanthelasmas. It sounds complicated, but looks quite simple. These are small yellowish or whitish plaques, resembling bumps or nodules, that appear on the skin of the eyelids, often near the inner corner of the eye. They can be soft or firm, single or multiple. What are they? Essentially, they are cholesterol deposits under the skin, and although they are harmless in themselves and cause no pain, their appearance can be a signal of high cholesterol levels in the blood or lipid metabolism disorders. and high cholesterol, as we know, is one of the main risk factors for atherosclerosis, the very process where plaques form on the walls of blood vessels, narrowing their lumen and hindering normal blood flow, including in the heart's vessels. The appearance of xanthelasmas, especially if they occur not in advanced old age, but earlier, say after 50, 60 years, is a strong reason to check your cholesterol level and discuss it with your doctor. Remember Eleanor, she's 68. She always took pride in her appearance, took care of her skin. So when she noticed these small yellowish spots near her eyes, she was initially upset purely for aesthetic reasons. She tried to conceal them with makeup, sighed looking in the mirror. She thought they were just age-related skin changes, maybe some kind of pigmentation. She was sure she ate correctly. No fatty fried foods. The thought of cholesterol didn't even cross her mind. She felt generally fine, well, sometimes more tired than usual, but who isn't at her age? However, her friend, a retired nurse, once noticed these spots and gently advised Eleanor to get a blood test for a lipid profile. Eleanor initially waved it off. "Oh, stop, it's just my skin." But her friend's words stuck with her. She felt a slight internal resistance. She didn't want to admit that something might be wrong, but she went and got the test done anyway. Imagine her surprise when the results showed a really high level of bad cholesterol. The doctor explained that the xanthelasmas were a visible signal of what was happening inside her blood vessels. She was prescribed statins and given detailed dietary recommendations. It turned out her healthy diet wasn't quite balanced. Eleanor started taking the medication, changed her diet, added more vegetables, fish, whole grains. 6 months later, her cholesterol level normalized. The xanthelasmas, however, didn't disappear, but Eleanor looked at them differently now, as a timely warning that helped her avoid serious heart problems. She felt immense relief and gratitude to her friend and to her body for this signal. Imagine these yellowish plaques as small signal flags your body puts out to say, "Attention, fat levels in the blood are high, time to check the vessels. Don't ignore these flags, they could save your health." Speaking of eyes, there's another feature associated with age, but sometimes carrying additional meaning. We're talking about the so-called arcus senilis. This is a grayish or whitish ring that appears around the edge of the cornea, the transparent outer layer of the eye. Perhaps you've noticed this in acquaintances or even yourself in the mirror. In many people over 60-70, such a ring is a normal age-related change associated with lipid, fat deposits in the cornea, and it doesn't always indicate heart problems. However, if such an arc appears in people younger than 50, 60 years old, or if it is very pronounced, it might be linked to high levels of cholesterol and lipoproteins in the blood, which, as we already know, increases the risk of cardiovascular diseases. The cornea itself has no blood vessels, but lipids can penetrate it from the blood vessels at its edge. Therefore, a pronounced ring can indirectly indicate that there are too many lipids in the blood. Meet David. He's 65. He'd worn glasses since youth and regularly visited an ophthalmologist. It was the eye doctor who first noticed a rather distinct grayish ring around his cornea. "David," the doctor said, "this is called arcus senilis. It's common at your age, but yours is quite pronounced. Have you checked your cholesterol recently?" David shrugged. He felt perfectly healthy, walked a lot, played golf. "Why?" "Nothing hurts," he replied. He was always a bit stubborn and disliked doctors, considering them alarmists. He thought that as long as he was active and energetic, there was nothing to worry about. He would have quickly forgotten this conversation with the eye doctor if not for an incident. A couple of weeks later, his best friend was hospitalized with a heart attack. This was a real shock for David. He suddenly realized that health is fragile and that nothing hurts is no guarantee. The ophthalmologist's words came back to him. He felt a pang of anxiety and decided to check that cholesterol after all. The tests showed borderline high values. The cardiologist he consulted confirmed that although arcus senilis itself isn't a disease, in his case, it could indeed be a marker of increased risk, especially considering the test results. David didn't need strong medication, but the doctor strongly recommended he review his diet, less saturated fat, more fiber, and be more attentive to his condition. David took it seriously. He understood that his activity was wonderful, but the internal processes in his body required no less attention. He became more mindful about his diet, started regularly monitoring his blood pressure and cholesterol. And he felt calmer. Not because the problem disappeared, but because he knew about it and was taking steps to control it. Imagine this grayish ring as a light haze or fog at the edge of a window. Sometimes it's just the weather, age, and sometimes it's a signal that something is happening inside the house, body. For example, the clarity of your vessels is getting foggy due to excess fats. It's worth taking a closer look. From structural changes like creases or deposits, let's move to the color of our face, specifically lips and fingertips. The fourth sign to pay attention to is a bluish tint to the lips or nail beds. In medical terms, this is called cyanosis. Of course, lips can turn blue from cold, that's normal. But if you notice a bluish tint on your lips, tongue, or fingertips, especially under the nails, when you are calm and warm, this can be a very serious signal. What does it mean? A bluish color appears when there isn't enough oxygen in the blood, or when blood circulates too slowly through the small blood vessels. Both of these causes can be directly related to heart or lung problems. For example, if the heart isn't pumping blood effectively, heart failure, it stagnates in the vessels, and tissues don't receive enough oxygen. Or if there are lung problems, the blood simply doesn't get adequately oxygenated. In any case, persistent or frequently occurring cyanosis is a reason for immediate medical attention. Margaret, 70, lived alone and always considered herself quite robust. Yes, she had slight shortness of breath, but she attributed it to smoking in her youth, though she quit 20 years ago. Sometimes she noticed her lips turned slightly blue, especially after minor exertion, like carrying bags from the store. She thought it was just fatigue or perhaps cool weather. She got used to it and paid no attention. Internally, she feared doctors and hospitals tried to not notice unpleasant symptoms, hoping they would go away on their own. She felt that admitting the problem would instantly make her a sick old woman, dependent on medications and doctors. One day, her granddaughter, a medical student, came to visit. She immediately noticed the bluish tint on her grandmother's lips, even when she was sitting calmly in her chair. The granddaughter gently but persistently persuaded Margaret to get checked out. Margaret resisted for a long time, saying it was nonsense, that her granddaughter was scaring her. But eventually she agreed, mostly out of love for her granddaughter. The examination revealed that Margaret had chronic heart failure, which had developed gradually and unnoticed. Cyanosis was one of its clear signs. The doctor said it was good they came in now, before her condition became critical. Margaret was prescribed treatment that significantly improved her well-being. The shortness of breath decreased, the bluishness almost disappeared. Most importantly, the fear was gone. She realized that knowledge and timely treatment weren't a sentence, but an opportunity to continue living a full life. She was grateful to her granddaughter for her persistence and to her body, for this alarming yet important signal. Imagine blood as the river of life, carrying oxygen to every cell. If the river becomes slow, stagnant, or if there's little air, oxygen in it, then the banks, our tissues, lips, nails, acquire a bluish, lifeless hue. This is a cry for help from your body. I'm not getting enough oxygen. Listen to it immediately. A bluish tint to the skin indicates problems with circulation or breathing. But did you know that the condition of your gums can also tell a lot about the health of your blood vessels? The fifth point on our list might seem unexpected. It's the condition of your mouth specifically, the health of your gums and teeth. It might seem unrelated. What's the connection between teeth and the heart? It turns out it's quite direct. Chronic gum inflammation, periodontitis, bleeding gums, loose teeth, and especially tooth loss can be associated with an increased risk of cardiovascular diseases. How does this work? Firstly, the bacteria causing inflammation in the mouth can enter the bloodstream and cause inflammation in the vessel walls, promoting the formation of atherosclerotic plaques. Secondly, chronic inflammation itself in any part of the body, including the oral cavity, creates an overall inflammatory burden on the organism, which negatively affects the condition of blood vessels and the heart. Therefore, if you suffer from serious gum problems, if your teeth have become loose, or if you've lost many teeth not due to trauma, this could also be an indirect signal of trouble in your cardiovascular system. Robert, 75, was always a bit self-conscious about his smile. He'd had problem teeth since he was young, and the situation worsened with age. His gums often bled, and several teeth had to be removed. He considered it an inevitable attribute of aging, plus he didn't particularly like dentists. Well, they fell out, so what, he thought, chewing food with difficulty. He had long suffered from high blood pressure, took pills, but not very regularly. Sometimes he felt a tingling in his chest, but attributed it to nerves or osteochondrosis. He certainly didn't see a connection between his bad gums and his blood pressure. One day, his primary care physician, noticing the poor state of his oral cavity during a throat examination, recommended he not only visit a dentist, but also undergo a more thorough cardiac evaluation. Robert was surprised. What do teeth have to do with it? The doctor patiently explained the possible link between chronic inflammation in the mouth and the state of his blood vessels. Robert was skeptical, but complied. The dentist confirmed severe periodontitis and insisted on treatment. And the cardiac evaluation revealed significant changes in his heart vessels, requiring a more serious approach to treating his hypertension and preventing ischemia. Robert began treating his gums and became stricter about taking his blood pressure medication. He noticed his overall well-being started to improve, his blood pressure stabilized, and the unpleasant chest sensations became less frequent. He realized the body is a single system where everything is interconnected. Oral health turned out to be no less important than blood pressure or cholesterol levels. Imagine your body as a house, and the oral cavity is both its front door and foundation. If there's constant inflammation, cracks in the foundation, gums, it weakens the entire house, body, and can lead to problems on the upper floors, heart, and vessels. Caring for your gum health is caring for the strength of your entire house. So, we've gone through 5 potential signals, from the earlobe to the state of the gums. What should you do with all this? I want to emphasize the most important thing once again. None of these signs by themselves is a 100% diagnosis of a heart attack or heart disease. They are merely possible clues, signals that our wise body sends us. Your task is not to panic, not to self-diagnose based on the internet or this video, but to exercise healthy caution and attention to yourself. If you notice one or more of these signs in yourself, or if something about your well-being concerns you, please do not postpone a visit to the doctor. Tell them about your observations and concerns. Only a doctor can conduct the necessary examinations, measure blood pressure, perform an ECG, blood tests for cholesterol and sugar, possibly an echocardiogram, and determine if there are real reasons for concern and what treatment or prevention you need. Remember, early diagnosis is the key to successful treatment and a long, active life. Don't be afraid to seek help. Your doctor is your main ally in healthcare, and even if you don't have any of the listed signs, that's wonderful, but it's not a reason to relax. Prevention is always better than cure. Continue to lead a healthy lifestyle, eat a balanced diet, be physically active as much as possible, control your weight, quit smoking, try to manage stress, and, of course, regularly undergo preventive checkups with your doctor, even if nothing bothers you. Imagine your health as a beautiful garden. For it to bloom and delight you for many years, it needs care, watering, fertilizing, protection from weeds and pests, and occasionally inviting a gardener, doctor, for inspection and advice. Your health is in your caring hands. Here we are at the end of our conversation. We've discussed an important and delicate topic, the subtle signals our face might give us about the state of our heart. I hope this information has been useful to you and provided awareness rather than anxiety. Remember, your life experience is a priceless treasure, and your wisdom allows you to treat your health with attention and responsibility. You have every right to feel good, energetic, and joyful at any age. Don't be afraid to listen to your body, don't ignore its signals, but also don't panic. Use the knowledge gained as a reason for self-care and for an open dialogue with your doctor. Take care of yourselves, listen to your body with wisdom and love, and remember, you deserve the very best: health, joy, and many long years of active life.